provider, again, across these 32 different states and kind of massive provider groups. And really what we focus on as a company is really addressing the access to care crisis that exists in obstetrics. So if you just look at the rural kind of map of the country, 50% of counties lack a practicing OBGYN. And so when you start thinking about, patients having to drive 3, 4, 5 hours to see their provider for 5 minutes, that creates massive problems. We really have an infrastructure problem in delivering better care to our pregnant patients. Next slide, please. And this isn't necessarily just a rural problem, and I think Dr. Shah really hit on this. We're based in DC, and we have more per capita doctors than most cities in the country. But if you live on the east side of the city, all of a sudden, your landscape and the options that you have as a patient, a pregnant patient, completely change. So you go to the next slide, please. So like I mentioned, if you live on the east side of the city, there is no L&D for you to go to. There is no maternal fetal medicine group for you to visit. And so when you start thinking about, okay, I need good prenatal care, Dr. Shah mentioned this, and so I'm glad we think the same way. You have to take 2 buses, 2 trains to just see your provider for 5 minutes. And if you look at where all the challenges are in outcomes in this patient population, it's in the Medicaid patient population. And so they're having to choose between working and getting paid and putting food on the table, or getting good care. And we think that that's unacceptable, which is why we built the Babyscripts experience, which is really focused on making care available at any time and at any place through this asynchronous experience.